So, sadness and depression are two terms that are often used interchangeably with each other, but that are extremely different from each other in terms of their duration, intensity, severity of symptoms, and the overall effect that they produce on our persons. So, in this context, in this topic, today we are going to discuss about the difference between sadness and depression. We are going to talk about what is sadness and what is depression. We are going to talk about how to manage depression or how to find a quick hack for depression, and we are going to be discussing about when to get the help for your depression. Let's get started. The first thing that comes into mind when we talk about sadness or depression is a negative emotion, a sense of emotion that is characterized by tearfulness, agitation, lump in your throat, the urge to cry, or a feeling of disturbance. But how do you know whether or if it is sadness or it is depression? Because sadness is a generalized term, but depression is a medical term, often misused medical term that a lot of people misuse, but which should not be used, because whether or not you are depressed depends on the diagnosis made by your clinician. So let me make 4 examples and you decide whether you should label it as sadness or we should label it as depression. So example number 1 or scenario number 1, you just got or you just got a rejection letter from your dream job. You wanted to apply to that job and you were very keen for that job. It was your dream job, but you did not get it. Somehow you did not get it. Scenario number 2, you had prepared for an examination and you were very confident, you had given your 100% for that examination, but when the results came out, you had not qualified for that examination. That examination was very good or very important for your personal life, or it was important for your personal growth, but somehow you did not qualify in that examination. Now, scenario number 3, since a few months you have been observing or you have been feeling persistently low. You do not enjoy the activities that used to make you very happy. You are struggling to get out of bed every morning. You do not feel the urge to eat. You do not feel the urge to sleep. You cannot sleep at night. You have trouble focusing. You have trouble concentrating at work. These symptoms have been going on, and this has started to impact your work life. It has started to impact your social circles, and it has started to impact your personal life as well. This is what is troubling, and this is when you should consult a physician. Now, one more scenario. You have experienced a lot of misfortunate events in the past year. You have experienced the death of a loved one, or you have experienced the death of a pet that was in your family for a very long time. You have undergone a breakup, you have undergone a loss of job, and you are experiencing a sense of social withdrawal. You feel a sense of hopelessness, you feel a sense of despair, and even after 6 months, you are not back to normal. You have stopped socializing with your friends, you have stopped going out, you have difficulty completing basic tasks, and you are frequently contemplating self-harm. So this is when you should get the help for your condition, because these are symptoms of depression. Sadness is a temporary emotional response to a specific event or circumstance, which is normal and which is natural. The loss of a loved one, or a breakup, or the loss of a job, or any physical obstacle in your path, that is what will cause you sadness, and it is natural. But when the sadness is persistent, and when it is accompanied by mood swings, when it is accompanied by physical symptoms, then you should get the help or you should consult a physician. Depression is a persistent and long lasting mental health condition that is characterized by a feeling of sadness, hopelessness, and a loss or interest in the activities that at one time used to be enjoyable. In order to be diagnosed with clinical depression, you should consult your physician, or these symptoms should persist for at least 2 weeks or longer, or they should interfere with your daily life. So when should you consult a physician regarding your depression, or when should you understand that this is the time to take help for your condition? There are certain symptoms that when you observe, that will make you understand that this is the time when I should get help for my condition. And what are these conditions? First of all, loss of sleep. You are experiencing sleep disturbances. You are experiencing a loss of interest in whatever activities you are doing. You are persistently sad. You are persistently in a low mood. You have difficulty concentrating. You are experiencing unnatural fatigue or low energy. You cannot, or you are lacking the energy to even move your hand or even continue basic tasks like brushing your teeth, like getting up from bed, like picking up something from the table. That is causing you problem. You are socially withdrawing. You are having speech difficulties. You are noticing physical changes in your body, physical symptoms like pains that do not have any reason. You are observing digestive problems, you are observing headaches, or you are having psychomotor changes like behavioral changes, or you're observing like you have slowed down in your movements. You're experiencing a slowed down speech, or slowed movements, or you are contemplating self-harm. This is the time when you should consult a physician, because these are symptoms of depression. Sadness and depression may go hand in hand, but they are not the same. Sadness is a temporary phenomenon, the symptoms of which eventually go away. It can be triggered by external events or circumstances, but eventually it is natural response to the ups and downs in life, and it will go away. But depression can have complex causes. Depression can be because of genetic factors. It can be because of trauma. It can be because of chronic stress. It can be because if you have a genetic tendency of mental problems in your family. So even if you experience all the above symptoms, if they persist for 2 months or above, and if they are interfering with your day-to-day life, this is when you should get the help for your condition. Now, diagnosing depression, it comes with a step-by-step activity. Now, any medical practitioner or any licensed social worker, they can diagnose depression. See, diagnosing depression is done by trained medical health professionals, psychiatrists, psychologists, licensed clinical social health workers. They can diagnose it for you. But for that, you have to undergo a clinical interview. There will be a diagnostic criteria. The diagnosis of your depression will be outlined in the Diagnostic and Statistical Manual of Mental Disorders. On the basis of the guidelines, the physician will assess your condition. They will ask you questions, and they will ask you to grade the severity of your symptoms, like on a scale of 1 to 5, how difficulty do you have in sleeping? On a scale of 1 to 5, how difficulty do you have in doing your day-to-day activities? These are called assessment tools, or they are called the patient health questionnaires. On the basis of that, and they will rule out other conditions as well. Other conditions like you may not be having depression, but you may be having bipolar disorder. You may be having anxiety disorders, or you may be having medical conditions that are mimicking depression. They will determine since how long you have been having this, whether or not these things have been happening for 2 weeks or they have been happening for a much longer time. And they will assess the severity of your symptoms. On the basis of that, depression can be of 4 types. Depression can be mild, depression can be moderate, depression can be severe, or depression can be clinical depression. In mild symptoms, the symptoms are usually short lasting, like you have the symptoms but you can get along with your day-to-day activities. But in the other moderate to severe depression, it becomes very difficult to carry on your day-to-day activities. Sometimes you may have recurrent depression, in which even after getting help, the symptoms come back and you have to deal with it for the rest of your life. You have to get treatment for the rest of your life. you have to be sure, or you have to find out ways in which you can cope up with your depressive tendencies. There are medications, there are treatment options, but there are some easy hacks as well in which you can deal with your depression. Let me discuss them. The first hack that you can use to deal with your depression is through deep breathing. Whenever you have negative thoughts, all you have to do is you have to inhale and exhale slowly. Deep breathing helps you calm your nervous system, and it helps reduce symptoms of anxiety and stress that accompany depression. The second way is through mindful observation, in which whenever you are having a panic attack or whenever you are having depressive thoughts, all you need to do is find an object in your immediate environment. It can be a painting, it can be a pen kept in the pen stand, it can be pens kept in the pen stand, and you need to start counting the pens. You need to start seeing the color of the pens. You have to focus on the pens, or you have to focus on the paintings, and you have to take your mind away from depressive thoughts. The third is body scan. As mentioned earlier, depression is often accompanied by physical symptoms that do not have any underlying cause. But in this method, by performing a body scan, you have to mentally move your attention through each and every part of the body from your head to the toes. And you have to observe any areas of tension, any areas of, it may pain here or here, and you have to release the tension as you focus on these parts. They will help you in reducing the physical symptoms of stress associated with depression. A very good way of dealing with depression is through grounding exercise. In grounding exercise, you have to engage your senses by identifying, or you have to identify 5 things that you see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. Now what happens is, in depression we often lose our taste, or we often lose the urge to eat, and by doing the grounding exercise, some people can get their appetite back, and this can help them get their depressive tendencies back on track. Now Mel Robbins has a very good way of dealing with these symptoms, and this is called the 5-second rule. Now what happens in depression is, you often have the urge to be in one place and not get up. Getting up or breaking through the toxic cycle becomes very difficult for you. Now, according to Mel Robbins' 5-second rule for success, the moment you feel yourself hesitate before doing something, count from 5, 4, 3, 2, 1 and move towards action. Count from 5 to 1 and move towards action. If you don't move in 5 seconds, your mental habits take over and kill your instinct to change. So by following the Mel Robbins 5-second rule, you can get rid of this toxic cycle in a much better manner. There is mindful walking as well, in which whenever you are feeling depressive thoughts or you're in a depressive mood, get rid of the surroundings that you're living in. Go for a short walk. Pay attention to each and every details that you are looking. Imagine the feel of your feet lifting and touching the ground. Feel your feet touching the ground and feel your feet lifting up as you are walking. Feel every part of your movement. Notice the sounds, notice the smells, notice the sights. Walking mindfully can help you get rid of or get out of a toxic depressive thought cycle, and it can bring you back into the present moment. And there is guided meditation as well, in which you can use meditation apps, or you can use recordings. They can provide a structured way to practice mindfulness regularly, which will have a good or positive effect on your mood over time. So we have to remember that when we are talking about sadness and depression, sadness is just an external symptom and depression is a much underlying cause, like the tip of an iceberg that goes way deeper than just sadness or negative thoughts. So when you are seeing the symptoms, or when your symptoms of negative thoughts do not go away even after 2 weeks, then it's time to consult a physician. But other than the physician advised therapy, other than the physician advised medications, you can practice these methods to instantly get rid of depression. And please remember that a healthy life, not indulging in alcohol or not indulging in toxic substances, leading a healthy life, going to sleep on time, having healthy sleeping habits, even the place where you sleep in, that should be clean. That is called healthy sleeping habits. In cultivating healthy sleeping habits, these can help you live a better quality of life and deal with negative thoughts in a much better manner. Thank you. If you like this video, please hit the like button and watch my content daily. Thank you.